Hafaday and welcome to another episode of Pacific Matters in 2022. And on this episode, we're taking a closer look back at the COVID-19 response in the CNMI that led to Saipan's first surge. In our first story dating back to March 2020, the CNMI officials report one of the first suspected COVID-19 related deaths. CNMI Governor Ralph Torres and hospital CEO Esther Muña announced a 70-year-old male passed away yesterday on Saipan. His death related to what they believe is COVID-19.
Specimen has been sent out to Guam Public Health Lab, and we are awaiting the results of COVID-19 testing.
The deceased CNMI resident sought help at the hospital on March 25th and was put under quarantine as a person under investigation with his wife at the designated Kanoa Hotel facility.
The deceased male had no travel history, but contact with someone who had tested positive for COVID-19.
Muña confirmed that the case is related to the NMI's first confirmed coronavirus patients announced on Saturday. Governor Torres expressed his sympathy for the family.
Our thoughts are with the deceased family during this difficult time. We will render all necessary assistance to his family.
The governor also handing down strict directives, expanding curfew from 7 p.m. to 6 a.m. for all residents. Exceptions were made for first responders, medical workers, law enforcement, and private sector employees on duty within the hours. These restrictions take hold as the hospital ramps up its own safety measures. As of news time, the NMI sent 20 specimens to Guam for testing. They await 11 results and planned to at least test 8 more individuals today. Guam Public Health Director Linda Denorsi on KUAM's Containing COVID-19 special report tells us that 5 tests are set aside for the NMI per day on Guam, in addition to those which might be sent off-island. On Saipan, CHC Dr. Beth Conan echoes the message to stay home.
Don't assume it was just in one place. Assume it's everywhere. Everyone needs to be careful. Everyone needs to stay home. Everyone needs to wash their hands. It was not just in one neighborhood. It is everywhere.
And in this next story from April 2020, drive-through testing began on Saipan. Alina Concepcion is the first to undergo drive-through community-based testing for COVID-19 on Saipan.
Please get tested.
Free testing is now available for anyone in the Northern Marianas wanting to be tested. Hospital CEO Esther Muña says they can run over 400 Solgent tests a day.
Saipan residents must be registered to get their nasal specimen collected at the Saipan International Airport at their designated time and day. The arrival and departure areas will be used to accommodate drive-through specimen collection from registered vehicle passengers.
Testing is not mandatory, but the task force encourages residents to request a test. The governor's office producing this 8-minute video outlining the 5-step process.
Step 1 is to request a test. This can be done either online or by phone.
Residents will be called back to schedule the appointment and given a test number. Testing is limited to 4 people per vehicle. The governor's office tells KUAM that positive cases will be quarantined at the Kanoa Resort facility, followed by contact tracing.
Our goal is to provide you with your results as quickly as possible within a reasonable time frame.
They're preparing to bring drive-through testing to Rota and Tinian. On May 13, 2020, KOAM took to the streets to visit some Saipan businesses who were persisting through the pandemic. Here's more. With most people staying at home, many businesses are trying to stay afloat. Philip Canuto has managed Island Touch on Saipan for the past 7 years.
For the past 2 months, we have exhaled but very little.
These days, much of the flowers, leis, and heart-shaped pillows go untouched in his shop in what is usually a bustling senior prom and graduation season. Couples' vows also have to wait.
I have a 6 weddings supposed to be for May and June. That's really confirmed, but they canceled.
Just a few minutes away, Rob Trevilla runs Tribe Mariana's clothing store. Their doors have been shut for over a month. It's not the first storm he's braved.
It brings me back to like Typhoon U2, you know, when I was one of the people during Typhoon U2 that lost their home. And I was really devastated and depressed during that time, but it took a lot of my close friends and family to tell me that, hey man, by you being down and depressed and, you know, and trying to shy away from society, it's kind of like when they turn on the bat signal and Batman never shows up.
But people continue to answer his call and shop online, their logo standing for a One Marianas approach to recovery.
It's something that we definitely do need to keep pushing to the community that we're going to get through this.
His partner also runs Selena's Beauty Works in Tumon on Guam, and she's feeling the pressure. Like many during these uncertain times, the question remains, what's next?
When times are hard, pray. When times are good.
And we'll be right back with more from the past year. Welcome back to the show. In our next story, we take a look back at our story from June 2020, a behind-the-scenes look at Saipan's first COVID-19 laboratory.
This is the COVID testing specimens on Diaplex come into this room first. Then this room here is used to mix up the reagents, so they do what's called the master mix in this room.
KUAM News going behind the scenes of the COVID-19 laboratory on Saipan. On the front line, Dr. Philip Dowderman says the public health response is in full force.
While the community-based testing was going, it was at least 90 a day, and some days 200 to 300 a day or more. When it first started, it was like 300 or 400 a day, and then it kind of slowed down after that.
With 5 testing platforms, the Commonwealth now aims at testing half of its population through a village-based initiative. Hospital CEO Esther Muñoz says building capacity was not easy.
We were worried that those people that were not coming in may have the virus and are further, infecting other people. So we wanted to it became a very high priority for us to get enough testing capability.
Muñoz says staff at the hospital are often tested with new guidelines. She wants to reassure the public that as the economy gradually reopens, the hospital is ready to hold the line.
We have the hospital capacity, increasing our ACS, the alternate care site, having that ability is that at the end of the day, it's about saving your life, and that's what we're doing.
And in April, we reported on the 60,000 test kits that the CNMI government acquired from South Korea. 60,000 COVID-19 test kits acquired for the Northern Marianas. Hospital CEO Esther Muñoz says they expect to be ready for community testing in 2 weeks.
For the purpose of public health, for the purpose of protecting our community, we believe that having a population-based testing capacity is necessary for our community, especially a community that is fragile. The healthcare is fragile.
Muñoz clarifying that these test kits from Asia are not approved by the US FDA, but have gotten the green light by its equivalent in South Korea. She says they have a high accuracy rate and are the same kits ordered by some cities across America.
On the public health side, we're utilizing the Korean FDA-approved, test kits for the purpose of surveillance, basically public health activities, including containment of the virus and not having further and widespread transmission.
As the entire country competes for supplies, Muñoz says it's not likely that the islands will get 60,000 test kits for the US FDA equipment already on site.
For example, we have positive cases. Of course, we are likely going to validate it with the FDA equipment.
A South Korean pathologist is on Saipan to train staff on how to use the equipment and conduct quality checks. More help is on the way. Overnight, Governor Ralph Torres announcing the construction of an alternate care site at Canoa Resort to treat confirmed and suspected cases.
I hope we never get to use it. But if we do need it in a month.
And in May 2020, we got a behind-the-scenes look at the grand opening of the alternate care site on Saipan, which is now being used to address the COVID-19 surge happening at this moment. Breaking overnight, there are 3 new cases of COVID-19 on Saipan. 3 males ages 19, 25, and 27 are in stable condition, asymptomatic, and isolated at Canoa Resort after testing positive. The CNMI Governor's Task Force says that it isn't clear if the cases are caused by current infections or if the tests are detecting viral debris of a prior infection. CHCC explains that the cases were most likely exposed through a small gathering of people from different households. As the number of cases increases in the Commonwealth, CNMI Governor Ralph Torres also unveiled the CNMI alternate care site with a tour for the legislature and media today at Canoa Resort. Though members of the minority say that they were not invited to the tour, the media rode on a bus with the governor and members of his task force to the alternate care site.
Every case is concerning, right? Obviously, we don't want to get any more cases, but the fact that our numbers is still low and our community continue to do social distancing.
Helios Engineering Group are the lead designers, with their engineers creating state-of-the-art facilities ranging from triage to pharmacy storage. The site is 70% completed. Patrick Guerrero is the governor's authorized representative who was along for the over 1-hour tour.
This here now is going to be a 50 ICU bed facility on the first level, and on this main wing up above, 5 floors, 152 mid-level care rooms. The property itself has an additional 72 rooms on the tower side.
Governor Torres took questions throughout the tour, sharing how he hopes the site is never used.
It's going to be costly, but you know, when you're talking about health, price is not an option. We don't deter making the right decision.
All right, we'll be right back with more on the CNMI's COVID-19 outbreak. Welcome back. In this next story, in May 2020, we address some of the issues regarding containment costs in the CNMI on containing COVID. There are now 21 confirmed cases of COVID-19 in the Northern Marianas. 2 more cases were announced by the CNMI government over the weekend of a 31-year-old male and 22-year-old female. The individuals were found through contact tracing and are in stable condition. They are contacts of prior cases.
And over 3,000 have been determined as negative. The community-based testing, again, that did result in 1 positive, which resulted in other contacts.
Community-based testing expands to Rota and Tinian. Today, Muñoz says that they're able to test up to 94 people a day. Any positive cases on the 2 islands will be medevac to Saipan for treatment.
Working along with Tinian and Rota to facilitate the 3-day community-based testing, and so far this morning everything's going well. So we'll keep you posted on outcome and results.
Meanwhile, on the economic front, a spreadsheet sent to KUAM shows emergency contracts as of May 8th. Among them is $11.7 million for PIC and $14.2 million for Canoa Resort quarantine and non-congregate shelters. The governor's authorized representative, Patrick Guerrero, at the legislature last week explained that these will be paid with federal funds and are markers not to exceed.
For us, it's not a matter of favoring somebody or a specific contractor. During the pandemic, during times of disaster, you got to look at what items, goods that can be provided at the time. And that's what we go for.
The task force notes how vital these facilities are to public health, especially with quarantine travelers. Members of the legislature continue to scrutinize spending.
We are concerned most fundamentally about transparency and accountability for all of these monies. And one of the issues that came up last week wasn't the awarding of contracts. And every contract, at least in response to this COVID disaster emergency, has been a sole source emergency contract.
Now, in more recent weeks, an essential worker from Guam likely caused the COVID-19 spike in community cases on Saipan. Here's our report from November. A non-compliant essential worker from Guam is linked to the recent spike in community cases on Saipan.
They're supposed to just go to work, go home or go to their lodging. What we found out from this essential worker was that they were actually thinking of attending a party. And so we did, bring them back to Canoa, and basically said that, you're done. you got to go back. But, and decided to leave right away. So, again, I cannot. The only thing I can say is that I cannot confirm, of course, because we still need to know if that was the individual. But we can confirm that the contacts were somehow connected with this individual.
It's unclear if any legal action will be taken. She says the focus remains on saving lives.
What we are looking at for the next step really is, basically strengthen our testing strategies. Also working with the contact tracing. The contact tracing is excellent. They do excellent work, and with the lab and our nurses here, really working really hard.
And with schools set to reopen in the coming days, vaccine mandates also loom.
Our board of trustees did approve the adding the COVID vaccines into the current law. The current law does require that students, if they're going to be attending school, they have to have a health certificate, and that requires that they get the vaccines that are, from measles, mumps, rubella, everything. We just added the COVID-19 vaccines into that.
She says the vast majority of comments they've received so far are in favor of the requirement, but has this message to those who are still hesitant.
These are safe. The vaccines are safe. They were not rushed. They were all tested, and there's data. Obviously, even FDA has given a unanimous approval. Let me just go back to that. FDA unanimously approved for the panel, approved the vaccine for children. So did the ACIP committee, the Advisory Council for Immunization Practices. They also unanimously approved these vaccines. So I have no reason to doubt that. This is a Chamorro traditional way of protecting your loved ones. So yeah, it is your choice, but you have to understand that, it's also some people don't have a choice, and it's unfair to them, and I feel like we need to be able to protect others.
So far, over 100 children received the first dose of the Pfizer vaccine on Saipan. The vaccine for kids was made available to families on Rota and Tinian on Monday. And in this next story, in December, we sat down with island mayors to discuss Tinian's first community cases. Contact tracers are on Tinian tracking down its first COVID-19 cases.
This is an inevitable. It meant to happen at this point of time. It's happening in Tinian. We have the first community spread.
There are at least 4 cases on Tinian as of Wednesday morning. The news comes as Star Mariana suspends all commercial flights indefinitely. Local leaders are deliberating on plans to address the spread on Tinian and whether or not to send all people who test positive to Saipan.
Send our people up to Saipan. Is Saipan have enough rooms to accommodate if this gets more than 100, 200 infected patients? Where do we go from that? Honestly, and I want to talk very frankly. Growing up in Tinian, and then this would also probably be felt in Rota. If we let our people, make our people continue to practice when you are positive, and we tell you, we'll allow you to stay at home, and we don't have to send you to Saipan, and allow you to stay at home and just don't go out.
Saipan is home to the NMI's only hospital and hosts the alternate care site and quarantine facilities at Canoa Resort and Marianas Resort. However, as of news time, it's unclear what protocol will be in place for possible cases found on Rota and Tinian. Vaccinations and testing are available on Rota and Tinian. So far, 1,654 people on Tinian and 1,466 people on Rota are fully vaccinated.
Think of your family. Come in and take your shots. The Tinian and Rota and the CNMI cannot be exemptions from the rest of the world. This COVID coming over to Tinian and through community is inevitable. It's going to happen. Now it happened.
Meanwhile, on Rota, there are no confirmed cases, but there are worries.
I'm praying to God every day that this horrible disease do not enter our island. The spike of the COVID-19 in Saipan seemed to change the minds of these people that have not been vaccinated yet.
86.7% of the NMI's eligible population is fully vaccinated. And after this break, we'll be right back with how people are transitioning to living with COVID. welcome back to another episode of Pacific Matters, and in our next story, we visit a new pharmacy that was set up at the alternate care site to augment the frontline battle.
This is basically set up as an extension of the pharmacy in the hospital. We do here coordination of whatever medication the patients need here at Kanoa or even in the other alternative care sites.
All hands on deck at the alternate care site as frontliners on Saipan battle the first surge.
Here we prepare the daily medications of the admitted patients, technically admitted patients, and even prepare Region COV for easy facilitation of processing, ordering, and preparation of medications. So when there's a patient needing Region COV or any other COVID therapeutics, it's here. It's being prepared and efficiently, and so that the patient do not have to wait.
They're working on transporting patients faster across the island.
We are coordinating all those pharmaceutical needs. So the outpatient pharmacy in the hospital, the inpatient, and this site coordinates what the patient would need so we can deliver and process fast.
As of Wednesday, there are at least 9 patients at the alternate care site, and as cases climb, the NMI hospital chief says home quarantine instead of in a government facility for those who test positive is being considered.
Everywhere in the world, when people are detected as positive, they can home quarantine. So those are things that are being considered right now.
She shares an urgent reminder.
Don't just go and get tested. Get tested and act as if you're positive so that you don't go spreading it to other people. What's happening is totally opposite. People get tested and then they go out and hang out with family members, and more people are identified. I don't know what to say.
And in our last story of this episode, we visit the COVID-19 community center that opened up in Koblerville on Saipan to address the COVID-19 outbreak and also help us live with COVID as we continue to see cases rise each and every day.
It doesn't mean that we're going to get results for you faster than we already are, but it does mean is that you have somebody, at least a face to go to, somebody to ask questions and get answers from. So that's what really the intent of this center is.
A community COVID-19 center in Koblerville adding to the frontline effort. They're able to refer people for treatment, confirm testing, conduct contact tracing, and provide critical information.
I think it's great that we can capture the positive cases and be able to direct them to their next line of care. And the monoclonal antibodies are to also help reduce any pressure on the ER and on the ICUs. So anybody with symptoms who gets the monoclonal antibodies, that helps reduce their symptoms and helps reduce the pressure on the hospital and the ER.
Frontliners are able to breathe easier with this new centralized effort.
Immediately once the nursing team or Tent 2 is done doing the swabs, the specimens are brought in here, and then it's processed here on this table, and then they're laid out here for about 15 minutes for the results to come out.
That effort comes with an aggressive education campaign.
This is all close contacts. No one positive enters to this area. It's all negative folks who just are looking for resources on how to safely isolate and safely quarantine.
It's a holistic approach to living with COVID-19.
We have the tools to help you recover from this. We want people to start thinking about living safely with COVID.
Thanks for joining us on another episode of Pacific Matters. We'll see you right here next week.